Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over how to use Vashe wound solution. Okay, but first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. All right, so first we are going to be taking this bottle and writing the client's name on it. Okay, so there's a little spot back here. You can put the client's name and you're going to put the date that you're opening this. Okay, we want to make sure that we are keeping this as clean and sterile as possible. So always make sure you have washed hands, gloved. Okay, got to be very, very cautious to keep this all clean. Okay, now what we're going to do for cleansing the wound, because this solution can be used in a few different ways. So first we're going to talk about just cleansing the solution. Now, right on the back here, it says that it's used for debridement and disruption of biofilms and removal of microorganisms. Okay, so this is for those cases. So what you're going to do is you're going to grab one of your sterile gauze. Okay, once again, you're going to have clean hands, freshly washed, gloved. Okay, you get your sterile gauze and you're going to get it wet. Okay, you're going to kind of wring it out so it's not completely saturated, so you're not getting the peri wound like soaking wet. And you're going to stick this into the wound base and it like touching everything. Okay, so if there's any like cavities or sinuses, tunnels, undermining, anything like that, make sure it's tucked into all those areas. You're going to leave this for 3 to 5 minutes for suspected biofilms. Okay, so that's scant to light slough. If you have a more moderate, heavy amounts of slough necrotic, you're going to leave it on for 5 to 10 minutes. Now you can change this halfway through. That's what I personally like to do. And that's what a lot of doctors order also. Okay, when this is done, you remove it using your little tweezers, and you're going to cleanse the wound once again with this. Okay, so put it on another sterile gauze and gently like wipe into it, trying to get off any of that loose slough necrotic tissue as possible. Okay, you're then going to take another sterile gauze and you're just going to pat it, not dry, but just get any excess solution out of the wound, and then you're going to dry the peri wound. Okay, every time you touch a wound, you should have a new sterile gauze. Okay, this prevents recontamination. Now, as I was saying earlier, with tunnels, undermining, if you have tunnels or undermining that are hard to get to, don't be afraid to put it on packing. Okay, just plain packing. I don't want to open this because it's sterile, but it's just plain packing and get it wet. Get it wet with this and put it into the wound using your cotton tip applicator. Okay, and let it sit there. Now, if you're using the Vashe solution as a wound filler on packing, okay, you're going to get it wet. Okay, get your packing wet with this. Wring out excess because you don't want too much moisture. Okay, you just want it just moist, and then you're going to pack the wound and any undermining sinuses, tunneling, and you're going to pat the peri wound dry, and just use an absorbent cover dressing that's going to maintain a moisture balanced wound for about 12 to 24 hours. Okay, because that's how frequently we'll be changing this wound packing. Now, if you're using it as a peri drain or tube skin cleanser, you're literally just putting some of this on a sterile gauze and going around the area. Okay, wiping the area, and then you're going to pat it dry with a dry sterile gauze, okay? So the solution itself, very easy to use. Now the frequency of dressing change, use daily for wounds or peri-drain tube skin cleansing. When used for a packing, you can do it daily or every other day, just ensuring that it's not drying out in between, okay? The expected outcome is that we have a decreased amount of wound debris, slough, or necrotic tissue within 1 week. Okay, so you should be noticing a difference, and signs and symptoms of local infections are resolved within 2 weeks. So I hope this video did give you a better understanding of how to use the Vashe Wash wound solution and why we're really using it. I do have another video. I'll link it just at the end of this video of everything you need to know about the solution, when you use it, contraindications, all that. I do have another video, but I just wanted to have this specific video that went over the exact steps of really what you would be doing to use it. But that's all I have for today's video, guys. I hope to catch you in my next one.